I'd like to thank you all for your time and attention today. We have a really great speaker coming up after me. I was giving you more of a national perspective of the Affordable Care Act and seniors and retirees. And we have Mr. Nick Beamer here today to give us more of a state focus on the ACA. I'm just going to tell you a little bit about Nick before he comes up. Nick's work experience in education encompasses both social and healthcare related fields. Since 1987, Nick has been employed as the Executive Director of Aging and Long-Term Care of Eastern Washington, the designated area agency of Aging for Spokane. In 1995, he served as a delegate to both the state and national White House conferences on aging and was a member of the Leadership Spokane class of 1997. He currently serves on the board of the Washington State Association of Area Agencies on Aging and is a member of its executive committee. He was elected in 2010 to a second three-year term as a regional representative to the board of the National Association of Area Agencies on Aging, where he currently serves as first vice president. Nick has a master's degree in health services administration from the University of Michigan. He and his wife have raised a daughter and enjoy many outdoor activities together, including hiking, camping, and fishing, which sounds great. So Nick, come on up. Thank you so much for being here, and I'll turn it over to you. Thank you so much.
Thank you. Well, I have a few notes, so I'm going to sit at the table up here. And is this on? It is on. Denny, how are you? Good. Good to see you. It's been a long time. Yeah. Well, in case some of you don't know what an area agency on aging really does, there's one symbol that I like to keep in mind all the time, and that is, there's no place like home. Everything that we do at an area agency on aging is geared to help older adults if they need assistance with activities of daily living, things like meal preparation, for example. We can help out so that you can stay at home and not have to go to a nursing home. Anybody have an idea what a nursing home costs these days per day?
4,000?
No, we're not there yet. But when you look at a per monthly cost, it's closer to $5,000 to $8,000 depending upon whether you're private pay, whether you are part of the Medicaid program, and whether or not your prescriptions are included in that kind of a cost. I have about 9,000 individuals that we help in 5 counties. And I have a $10 million budget. Anybody good with math? If you are, that comes out to about $1,100 per year to help that individual stay at home, as opposed to the nursing home, which is probably going to be around $70,000 at least per year. So you can see why, when we take a look at the program that I have, it saves money. And it does save money through Medicaid as well. And hopefully, we will be part of healthcare reform so that we can continue to do that. Now, I promised to share just a few statistics with you folks in terms of what happens statewide with the Affordable Care Act. Believe me, there's a lot to like about the Affordable Care Act, and you said that there's a lot yet to do. And I do agree, Danny, there is a lot yet to do. A couple things, though. You know, when I look at the Affordable Care Act, obviously the overall approach is to just expand access to health care insurance coverage. But when you look at it in terms of our state, there's a couple things in particular that I wanted to point out. You know, fundamentally, we're looking at that donut hole piece in particular. And when I look at the statistics that I've got here, I'm looking at approximately 60,200 individuals in the state of Washington that took advantage of that particular provision. And when you count the savings in the state of Washington, it was about $36 million. So this is certainly one of the ways where you see savings from what Medicare would have paid and Medicaid would have paid as well. Pre-existing conditions. Approximately 18,000 people enrolled in this particular provision, where it creates basically a temporary insurance program for adults that are uninsured, at least for the last 6 months. Another real important provision, I think. Those of us that have kids, my own is about 26 years old now, so she doesn't qualify for this, but the expanded coverage for adult dependent children was certainly an important part for us, in particular, of that act. The prohibition of lifetime limits in terms of a dollar value for individual and for group policies, to me, is an important provision. And when you go forward, you look at the fact that there will also be restrictions on the annual limits that are also currently out there. We talked about some of the preventative care things. Our agency's involved in 3 things that is really saving money for Medicare and Medicaid. One is called the Chronic Care Management Program. And that's where we help individuals, for example, with diabetes, who have a chronic condition. Over the last year, 4 of our agencies, just like myself, 5 in total in Washington State, have saved about $1 million from what would have been expended by these folks that are on programs and have learned that they have diabetes. What do we do to help that happen? We help them manage that at home by themselves, rather than going to the emergency room, for example. We help them take a look at their medications and how they're administered, and how they might be able to do that a little better. You know, some of the people we see come to us with 15 different prescriptions. And one of the programs that we run is called the State Health Insurance Benefits Advisors Program. Volunteers, many just like you, help people understand which plan out there is the best for them when they have 15 different prescriptions. That does save money in the long run for all of us in particular. We also have this thing called the Healthcare Transitions Program. This is another part of the Affordable Care Act, but in our state, several of the area agencies on aging are applying to CMS, Center for Medicare and Medicaid Services, to actually become what they call community-based organizations that help with care transitions. Now that's kind of a technical term in a way, but what it really means is that we're going to help you once you're discharged from the hospital and either go home or go to the nursing home. We're going to help you in terms of what is it that you need in the home setting to make this particular situation that you have work better. For example, if you have a stroke and you have a few days in the hospital, then when you go home, we will be working to see what you have in your home setting that might make it possible for you to do better than you would otherwise. Maybe you need a ramp, for example. Just access to the home has changed totally. Well, when you're looking at $70,000 a day or $70,000 a year for someone in the nursing home, a ramp looks pretty inexpensive when you're looking at that kind of thing. You know, there are some other things about the Act that I did want to talk about just a little bit because they're not obvious, and of course there's 2,000 pages in that Act, at least 2,000. One of the things is called bundled payments. Right now, if you go into the hospital for that stroke and you get 5 or 6 different procedures, that payment is to the physician, to the hospital, etc., is by procedure. The more procedures they do, the better off they are for reimbursement because they're going to make more money. What's happening right now is they're starting to look at what they call these bundled payments. And that is from the day you enter the hospital till at least 30 days after that, they're going to pay the hospital one lump sum. Doesn't matter how many procedures you have. If you have to be readmitted to that hospital, they're not going to get paid anymore. It's those bundled payments and mechanisms like that that will also save money for Medicare over the long run. They have something called value-based purchasing, which is another real technical term, but I'm amazed at this. Folks haven't always followed the outcomes, the health outcomes of individuals, and then paid on a basis where they do better and your outcomes are better. When they are looking now at how they would pay for performance, they're really looking at, we'll pay you a little better if the health outcomes that you have for that particular person are better. The person is healthier. So, those are just some of the things I wanted to talk about a little bit. I know some of that gets technical, but you know, how many of you have read the book by T.R. Reid, The Healing of America? A couple in this room. Did anybody go to the presentation down at the same two? I know it. I was amazed by that presentation. Just amazed. And, you know, the simple message was that in America we spend the most on health care and probably have what I would say are the least results for those expenditures. Our system does need to be revised. I don't know if the Affordable Care Act is the best way, but I know it is a good way. There are a lot of benefits for you as seniors in particular. The prevention benefits are amazing. Those kinds of things will make it more possible for us, I think, to both save money and make healthcare outcomes better, not only for you as an individual, but when we look across maybe a whole population of seniors, the outcomes when you look at longevity, when you look at how healthy you are, I think those are going to be better as well. So, I'll leave it there at this point. There's many other things that are possible to talk about, but that's enough. And if you have questions, I'll try and answer one or two of those. Yes?